Hello, my name is Dr. Steve Reiners, optometrist and owner of Complete Family Eye Care. And tonight we're going to talk about viral pink eye. I like the word conjunctivitis much better. Pink eye is a very overall, not an accurate term, but of course it's pink. But pink eye, but why is it pink? Is it from a viral situation, bacterial situation, allergy situation, something toxic got in the eye situation? So I prefer the word conjunctivitis, or inflammation in the conjunctiva, the superficial layers of the eye. And so today we're going to talk about a conjunctivitis caused by viruses. So right now it is December of 2023, so we're getting into the cold and flu season. Many of these things are viral situations. And one very common one going around right now is called EKC, or epidemic keratoconjunctivitis. So once again, epidemic keratoconjunctivitis. It's one of the biggest names for an eye problem that I know. So EKC we'll call it for short. Keyword being there is epidemic. Very, very catchy. So people with epidemic keratoconjunctivitis, usually they have other cold and flu symptoms too as well, the usual sore throat, congestion, a lot of times, well, very commonly fever, and oftentimes they'll have swelling of the lymph nodes. Is a little more unique to the situation right here in front of the ears, and they can be very palpable and very actually quite painful. So a headache with this also, and usually it prevents with a pretty significant conjunctivitis. Sometimes it can start with the conjunctivitis and go into the upper respiratory tract, or vice versa, and work its way into the eyes. But usually there's some degree of systemic illness with this problem. So when you have viral conjunctivitis, usually it's pretty prominent, and so you have a really overall swelling of the surface of the eye, lots of redness, irritation, really minimal secretion and discharge. So you don't get the eyes gunk shut in the morning. Usually a little more lid edema also, but just a very unhappy, drama-filled, just uncomfortable eye and uncomfortable patient in general. So the key thing with the viral conjunctivitis is proper diagnosis. So if you give someone like this, I should back up a step, with viral conjunctivitis, antibiotics don't work. Okay, this isn't a bacterial situation. You have antibiotic drops, and oftentimes make the inflammation even worse. So the viruses cause overall inflammation, so we want to get that inflammation down. So proper diagnosis by Dr. Sarah and I is key, and then also to the proper treatment course following with viral conjunctivitis, which usually viruses run their course. This could take several weeks for it to go away, but with proper eye treatment we can get it to go away probably in 1 to 2 to 3 weeks. And so initially we start with cold compresses, lots of preservative-free lubrication drops, oral decongestants, no Visine, no Murine, no Clear Eyes, none of that stuff, nothing to bottles. And then we usually put people on a steroid-type eye drop, too, a prednisone drop or something similar. Can really help a lot to bring the inflammation down too. So, and those are just prescribed by eye doctors and eye doctors only. So that's your best bet. And also cool compresses are helpful also. But the key to epidemic keratoconjunctivitis treatment, and first off, it's very catchy, so be careful with that too, but it is proper diagnosis. And to do that, you have to have the proper equipment, which Dr. Sarah and I have here, special microscopes and things like that to figure out why exactly is the eye pink and what's the best course of action and treatment. So, urgent care, your family physician, pediatrician, oftentimes they don't have the equipment to do those things, so they end up giving you the same antibiotic for everything, which can be very ineffective and actually not helpful in this situation. So if you have any sort of conjunctivitis, pink eye, for sure give us a call first. Dr. Steve and Dr. Sarah would be more than happy to help you figure out why your eye is pink and solve your conjunctivitis problems. So thank you very much for watching, and happy holidays.